Thank you for joining us for today's ASPPH Presents webinar, Job Task Analysis in Public Health, What are the Essential Tasks of Public Health Professionals, co-sponsored by the National Board of Public Health Examiners. This webinar is part of the 2015 ASPPH Presents monthly series, which has been designed as a service to CEIF-accredited ASPPH member schools and programs of public health. A few housekeeping items of note. While you are in listen-only mode and your lines have been muted, we encourage you to ask questions throughout the presentation by using the question box. We will address your questions at the end of the presentation, but may address a few burning questions throughout the webinar. Please be sure to refrain from placing your line on hold during the webinar. This webinar is being recorded and it will be available on the ASPPH website soon. Additionally, this webinar has been approved for 1 hour of CPH continuing education credit. Our speakers today are Dr. Richard Kurz, Dean Emeritus of the University of North Texas Health Science Center School of Public Health and Chair of NBPHE, and Dr. James Yeager, the Edith H. Schoenrich Professor of Preventive Medicine at the Johns Hopkins Bloomberg School of Public Health and member of the NBPHE Board. Thank you for being here today, Rick and Jim.
Well, thank you. I will be doing a lot of the presentation today, but I have encouraged Jim, if he has a comment, to please join us and make that comment as well. I want to thank all of you for joining us today for this webinar. It is an important opportunity for us to explain what we've done with the job task analysis and to ultimately answer any questions that you have about it. As we start the webinar, the first thing that I want to do is to thank two organizations that were instrumental in helping us create this. That is the Robert Wood Johnson Foundation and the Association of Schools of Public Health. Without their financial and other support, we could not have created this job task analysis and provided this webinar to you today. Can you move the slide for me? It's not moving.
Sure, just click into it with your mouse one more time and then you'll be okay.
Okay. First, wanted to review with you a few presentation objectives. We want to explain and talk about why we've done this job task analysis. We want to define what a job task analysis is and state the purpose of it for public health. We want to describe who conducted the analysis and what their functions were, and to describe the development of the survey, as well as to describe the survey respondents. And finally, we will take some time to describe the task domains and the specific tasks that were frequently selected by our respondents. In essence, we're going to cover then three things. We're going to consider the structure and the development of the job task analysis. We're going to consider the characteristics of the population that was surveyed, so you have an idea that the results we got were really based on a population that we can have some confidence as representing public health. And finally, a consideration of our results with regard to both the domains and the tasks ratings that we received from our respondents. So first, let me say a little bit about the purpose of the public health job task analysis. It is fundamentally to survey the domains and tasks identified by workers as associated with their positions as the basis, importantly, for refining the Certified in Public Health examination, which is sponsored by the NBPHE. As our purpose is to impact the CPH examination, our focus, as you will see, is on workers with advanced degrees and some experience. First, need to thank and describe for you the Job Task Analysis Advisory Committee. This was a very important group which helped us to put this job task analysis together. As you can see here, our committee had 3 representatives from the federal sector. We had 5 representatives from private employers, 3 representatives from local and county health departments, and 2 academic representatives. These were not individuals from the accredited schools and programs of public health, but rather individuals who were in other academically related public health roles. Each of these individuals does have significant experience and gave us an opportunity to create an instrument, I think, as you will see, which really does cover the field of public health very, very, very well. We want to really thank them for their incredible effort in this regard. This slide indicates what their responsibilities were. Basically, three broad areas. They gave us a clear idea of what the target population should be. Individuals with at least 3 years of experience in public health or a master's degree. We were not focused on entry-level individuals, although we certainly have some entry-level individuals in the sample, but that was not our focus. We also were not focused at the other end in the sense of highly, the most senior executive level individuals. We're really focusing on those individuals who are the middle-level workers in public health and who do have experience in advanced degrees. The next, they were able to give us the information that we needed to collect from our respondents about what they were like, so we would have a good idea in terms of their characteristics, as well as they did just yeoman's work in creating the survey for the job task analysis. And finally, they have been working with us to ensure that the survey is shared with as many people as possible, professionals and others in our field. The next slide indicates a little bit about a job task analysis, and this is perhaps for those who may be not familiar with this notion. What happens is that performance domains are identified, and then tasks that are performed by the professional group are identified. And to some degree, the necessary job skills that are associated with this. This is the foundation of certification examinations in many, many fields, and we, for the first time, are doing this in public health. These are often done every 5 years. So this is our first one, and we hope to return to this. Again, I should emphasize here that we are endeavoring to, with these tasks, to identify what individuals are actually doing on their jobs. This is not intended to identify what they should know or what they should be doing, but rather what they are doing in their tasks. And that is the essential character of any job task analysis. So the next element is to really focus on the domains as we began to do this. What should our domains be? And in working on this, we did many things in terms of literature review and the like. But we also looked at a number of categorizations of activities within public health by other units. Excuse me, the Council on Education for Public Health, ASTO, the ASPPH Framing the Future, Blue Ribbon Group of employers, and the ASPPH Framing the Future Group for the MPH report. All of these gave us ideas, and as you can see, our categorization of domains is very similar to what these other organizations did, and that gave us some confidence we were moving in the right direction. The next slide here gives you some idea about the number of individuals who actually we attempted to survey. We tried to spread this as widely as we possibly could within the field. We got, we think, almost 125,000 individuals who were recipients of our information. We did this through 51 organizations, including major public health organizations such as APHA, ASTO, CDC, and the like. So we think we, distributed this as widely as we possibly could into the field, and we're pretty successful, as I think you will see. This next slide gives you an idea of how the survey was structured a bit. there are 200 task statements. So it is an expensive survey. And when we asked people to complete it, we were asking them to really spend a little time working on this for us. The ratings we used were from 0 to 4, and as you can see, the individual who was rating the task said they never performed it, it was not very important, it was very important, or it was essential. So they gave us a 1 to 4 rating on each of these 200 tasks. What was the result in terms of the response to the survey? Well, about 8,100 individuals started the survey. A significant or a reasonable point was completed by about 7,500. Really, when we worked down through the surveys, we had about 48, 50 that were usable, and then we needed to make sure that individuals were employed and not students in the current analysis that we're doing. So that most of the analysis that you're going to see as we discuss it will be based on that final group of individuals that we identified. We're going to also, as you will see as we move through this and talk about the survey demographics and whatnot, we will, I think, argue that we have done a pretty good job of representing the field in terms of such areas as gender, the degree that was achieved, the years of experience both in general and in public health, the employment setting that individual had, their level of employment, the geographic level that they're working at, as well as their areas of expertise. So we tried to collect enough information, as you will see, to really give us an idea that we had collected information from a wide number of individuals and that we are getting the breadth that we need of public health workers in terms of their backgrounds. So the first slide gives you a little idea about gender and race ethnicity. I think these begin to represent a clear picture that we are representing public health at the levels we were considering pretty well. About 75% of the individuals were women. That's a reasonable representation, I think, of the field of public health. In terms of race and ethnicity, the largest population group was white individuals, but significant numbers of African Americans, Asians, and Hispanics, and I think pretty reasonable representation. This was not obviously a random sample of any group of public health workers. We sent this out broadly, and so we're really showing this in part to indicate to you that we are representing the field well. The next group to look at here is educational level. As I said earlier, our focus was on those with experience, but also those who had advanced degrees, master's or doctoral level degrees. And the reason for that really is that the CPH exam at this point, in terms of its eligibility, is two large groups really. One is folks who have graduated from an accredited school or program of public health, or individuals who have a level of experience but who have also completed the core knowledge in public health. And so we're focusing on that population. So you can see that we, again, did a fairly good job of representing the population that we wanted. The largest group is master's individuals, and then a fairly large group of doctoral folks, and a limited group in other degree categories. In terms of the graduate degrees, again, not surprisingly, I think we find that the MPH degree is the largest degree. We had respondents with a variety of master's and doctoral level degrees, which is, again, very typical of public health. We know that not everyone with a master's degree has an MPH, and certainly not everyone with a doctoral degree has a DRPH. So, but we do find a good representation of the MPH degree in our population, which is what, again, we would anticipate. The next slide shows you the employment experience. This is broken into two pieces. First is just general work experience, how much general work experience individuals had. And the second is public health experience. And as you can see, we again achieved what I think we were trying to achieve, which is to get an individuals in our sample who have a range of employment experience, so that we're not focused at new workers. We're not focused only at workers who've been in the field for a very long time. We're getting a cross-section of workers, both in terms of their general work experience and their public health work experience, who have different numbers of years in the field and can give us then a better picture of what their tasks are. The next slide tells you about employment details. The first is the employment setting, and we broke that out into 5 really broad areas of government, academics, not-for-profits, the health services sector, both hospitals and provider settings, as well as business settings. And again, in this regard, not surprisingly, a large number of the individuals were in the governmental sector, but also significant individuals, as we know, in these other sectors as well. Again, a good distribution. In terms of employment level, again, we felt confident here. The largest group at the top is mid-level, people in mid-level positions. Also got a goodly number of individuals in the upper and in entry level, as well as we gave individuals an opportunity to indicate they're more specialized in terms of consulting or clinical work, and have reasonable numbers of individuals in those categories as well. The next slide focuses on the geographic focus of their responsibility, and again, they were asked to select whether they worked at the local, regional, and regional includes state, national or international level. And again, a very good representation of individuals across these various levels, so that we feel confident that we're not excluding individuals who are working in a particular, at a particular geographic focus level. And that obviously is another way to look at our population and the importance of it. The next is a question that we asked, which is an interesting one, relative to what we will see in just a minute with regard to their job titles. We asked individuals to identify for us, not just their degree, but also their, as they saw it, primary area of expertise. And as you can see here, epidemiology is the largest of those categories, followed by health education, health promotion, environmental health, healthcare administration, behavioral and social sciences, public health administration, and other areas that we would anticipate finding as identified areas of expertise in public health. There's nice variety here, as we would expect, and a good distribution across those. As I said, this is not their necessary degree area, nor is it their job title, as we will see. This is what they picked as their area of expertise, and we got a very broad representation here. In the next slide, we do look at job titles, and this was a very interesting area in some ways. We, in fact, received hundreds and hundreds of different job titles. What you're seeing here on this slide is our categorization of those job titles into a smaller group so that we could represent them and perhaps later use them in further analysis. It is just extraordinary when you get the results that we got as to how many different job titles are used in public health. There is very little, you would say, consistency in that. We highlighted the epidemiology category here because you can see, although in the previous slide, most individuals were identifying their area of expertise as epidemiology, their job titles in only a little over 5% of the cases were epidemiologists or something that seemed like epidemiologists, so that we categorized them in that way. The largest group here is in management and leadership, and with a master's, focused with a master's and doctoral degree, we're not surprised that is indeed the case. There's things going on, and indeed we hope further analysis, to do some further analysis of these job titles with the hope that this may, in part, influence the field to some degree in terms of its future directions. The next slide here takes us into the analysis phase of what we did with regard to the ratings we got of the tasks into our, and broken out obviously by our, the domains that we established earlier in this process. What this slide gives us is an indication of the means and standard deviations for each of the domain ratings. The ratings, as you can see, shift from the highest being critical analysis and going down to biological and environmental applications at the lowest. All of these, as you can see, focus around, the scores focus around that middle category of important. So we see that many of the tasks were viewed as important, or indeed even very important by our respondents, and that the standard deviation also indicates there's a fair amount of distribution around these particular categories. It is interesting to see from this slide, perhaps, that the critical strategic analysis is the primary category. This seems to indicate that perhaps evidence-based activity, evidence-based related tasks are important to many of our respondents here, followed by the collaborating and partnering, as well as ethics. These are our major categories, and as we'll see, they have some diversity to them as we break them out a little bit in terms of some of our demographic characteristics. But this is quite meaningful in terms of the way the field is structured in terms of the tasks in these particular domains. We also provide here in this next slide some indication of what the top 10 rated tasks were, and it gives you some idea of how these broke out. A little hard to perhaps read these quickly, but I will suggest to you that 6 of these items fell into the critical and strategic analysis domain, 2 fell into the ethics domain, and 2 were in the collaborating partnering domain. But actually, if you look at the ethical items, about 8 of these items have to do with data collection and analysis, and the related ethical considerations having to do with data collection and analysis. And so it is clear that our respondents rated these elements as very important to what they do in their tasks as workers across the public health field. Now, what we're going to do next is we're going to break out some of these findings with regard to our some of the demographic areas that we collected data on. And that will give you a slightly different picture in some cases of how the domains and the tasks broke out for our respondents. The first of these is we break out by degree. This is an important thing for us to look at because of the notion that those who have an advanced degree, we want to know, we want to ask if their training makes a difference in the tasks that they viewed as important. I think what we draw from this although we're going to be doing more analysis as time goes on. But at this point, what it seems is that it generally does not. The scores of importance that are ranked very similarly in the total population seem to be ranked fairly similarly here. Advocacy is slightly more important, perhaps, for the DRPH candidates, DRPH degree holders. Apparently, their work tasks are fairly similar, regardless of which degree at this level they're holding in their particular jobs in the field. What were the tasks here? If you look at the tasks, we get a little bit different picture, but not dramatically different. 7 of the items are the same for both. They're not in the same order. The order in terms of ranking does shift somewhat from the other degrees, across the degrees, but it is generally the same. In fact, I think excuse me, this is the, I think I may have hit the key the wrong way, I guess. These are the top 10 degrees. I think I was showing you the wrong slide there. These are the top 10 for the breakout by degree. And as you can see, as I said, there's not a great deal of difference. The tasks that do seem to get eliminated from the master's to the doctoral side are those having to do with collaboration and partnering. They did not transfer over to the doctoral degrees and are found for more highly ranked as individual items by the master's candidates. And so it provides a little difference, but in general, we would say that for these 2 degree categories, there's not a great deal of difference in the tasks or the domain. Here we break things out by gender. And again, did gender make a difference in the importance ratings of our respondents? And it appears that this factor does make some difference, although not a huge difference. Ratings by females are very similar to the ratings for the overall population, which is not obviously surprising since 75% of our respondents were females. If we look at the male ratings, they were somewhat different. Management, finance, and policy domain is increased in importance in their mind, as is advocacy and the biological environmental applications. Communication declined somewhat dramatically, one might say. And then proficiency in diversity and culturally related tasks also declines. And another interesting matter, which we don't have a real explanation for at this point in time, is that the overall ratings for males are higher than those for females in all of the domains. Again, a difference that we haven't fully analyzed at this point in time, but gives you some idea of the difference between genders with regard to these categories. I'll show you a few of the items here that were related. These are the specific tasks that were selected by males, excuse me, did it again, by males and females in terms of gender. Again, as we said, top items don't seem to differ. The ones that were rated the most highly don't seem to differ very much. The order changes a bit, but the items are simply there. Only one of the collaboration and partnering items remains for the males, and so those seem to be more important to female respondents than they were to the male respondents in terms of these specific items. Next, we're going to look at task domains by employment setting. This, again, is something that we might ask ourselves, does being in one or another of these employment settings make a significant difference in how you would rate the domains and the specific items that make up those domains. As you can see, this figure demonstrates that there is some consistency across the sites, especially with regard to, again, the highest rated items. Those are the critical and strategic analysis items, ethics, and the collaborating and partnering items, which tend to come out high in general, and they seem to show consistency across these employment settings. Where there is variation, it seems to be with regard to program planning tasks, to the proficiency and diversity and culturally related tasks, and to a lesser degree, perhaps, the management, finance, and policy tasks. So as one moves down, things that are seen as less highly rated in general by each of these groups, we see more diversity in what they indicate that they're doing as most important to them in their jobs. This is, again, these slides are full of information and a little hard to diagnose, I'm sure, entirely as we go through them reasonably rapidly here. But what we did want to do was give you some idea of the tasks that were associated with these rankings, the highest rated, top 10 highest rated tasks for each of these categories, employment categories here. But one thing that you perhaps can see is we have put in white the tasks that are unique to each of these categories. In terms of the top ranked items, the not-for-profit organizations have the most unique tasks that were individually related highly. They also have the most collaboration and partnering tasks in their particular area, which is seems like a reasonable finding given our see at this point making entirely hard and fast interpretations of the data. But there do seem to be some pattern here with regard to the tasks for these different settings. The next figure here gives us the task domains by employment level. As we saw earlier, we've broken this out into two specialty categories, the clinical and the consultant, and then an increasing level of one's place in the organization, from entry to mid-level to upper level in the organization. Our results, again, seem to suggest some similarities and some differences. The greatest similarities, again, appear to be with the critical and strategic analysis and ethics tasks, but also here with, to some degree, with communication and advocacy across these settings. The greatest differences appear to be with regard to the biological and environmental tasks, as well as the management, finance, and policy tasks, and perhaps to a lesser degree, program planning and leadership and systems thinking. If you look carefully at this, you can see that with regard to the partnering and leadership and systems thinking, as you move across from entry level to mid-level to upper level, those seem to increase progressively. And with regard to a decline in importance, ethics, and the diversity and cultural proficiency seem to consistently be reduced across these three areas of entry, mid, and upper level. Now again, preliminary findings, but perhaps some indication of the activities that, in these domains that individuals are performing and at the rate is important in those performances. Oops. Here is the task by employment level broken out. Again, apologies for this being a somewhat complicated slide, but we did want to give you an idea of the individual task. Again, we did the unique task. We're left in white, so you can see those a little bit better, perhaps. Perhaps not surprisingly, the most unique tasks are found for the clinical group. And there, the emphasis is on communication. If you look across those items that are indicated in white, so that the other, when one gets down to the task, the other categories seem to have a good deal more consistency than this clinical group with regard to these specific items that they rated as their top 10 items. And again, perhaps not surprising, but simply something that is worth further analysis in our future. So that gives you some idea of the particular domains, how they're ranked, what items are seeming important within those domains. Clearly, there is consistency with regard to the strategic analysis, the analytical kinds of tasks within that domain, as well as the ethical tasks seem to be important across all of these categories in many, many cases. But that's simply a very broad and general representation of what we've found. And so we know we have a number of other steps and want to tell you a little bit about those and describe where we're going in the future. First, we need to do and have done at this point some more refined analysis of the task within each domain. We have begun this work with a factor analysis of the items. The domains that we used, as you could see, were those that were developed by our initial organizing committee, and were similar to those used by other organizations, but they are a conceptual creation by us and by the committee as to how we would proceed. So the factor analysis gives us an empirical reference point for the relationship among the items. And so we are taking a very careful look at that as we begin to use or try to use this job task analysis to impact the CPH exam. Secondly, a more refined analysis with all of the possible correlates of the ratings. As you can see, we've done some preliminary things in the information that we've given you this afternoon, but there's much more that can and should be done in that area. Thirdly, an analysis of the relationship of the task domains and the task of our current outline, our current content outline, as we call it, for the CPH examination. We have begun that process as well, using our factor analysis results to help us with that, but we need to focus on that because the primary purpose of job task analysis, indeed of our job task analysis, was to impact the CPH exam, to make it a better exam. It is intended to assess the competency of the individuals in the field with regard to the tasks that they perform. And so this job task analysis is crucial in that regard. And finally, we want to increase the distribution of these findings in our analysis of them to the profession and to the general public. We have done that through a series of presentations to groups over the past 9 months or so, we're doing webinars, and we hope that this gives you some idea of the results that we have found and raises questions in your mind. We hope many questions in your mind, frankly, about how we can proceed with this analysis in the future. Our final slide here is just a representation of the fact that our results, as I said, must reflect the content outline that we use. And we think that there is, in fact, some correlation or some systematic relation already between our findings here and what we have in our current content outline. But we are going to continue to use this information to restructure the exam with a long lag time before we would actually put it into the exam so that everyone would have a chance to adjust to that. But it is a very, very important step for us in moving to an exam that truly represents the tasks in the field, as has other professional groups. We want to use this job task analysis as a basis for our work now and in the future, and hopefully we'll do other job task analysis in 5 years or so. Finally, if you have questions, you certainly, we hope will ask them now. If you have questions in the future, please don't hesitate to contact Allison Foster, who is the president of the National Board. She is also a vice president at the Association of Schools of Public Health, and she would be happy to try to answer your questions, as would I. I'm listed my email there, her email is listed. So please don't hesitate to contact us if you have further questions or ideas after the webinar is complete. So given that, I am going to turn the program back to our moderator, who will provide the questions that you might have at this time, and we'll be happy to try to answer them.
Great, thank you for joining, thank you, Dr. Curves. We will now take this time to address questions. Please submit your questions by typing them into the question box. The first one, please define clinical as used in this activity.
I'm sorry, can you say the question again?
Sure. A participant asked you to define clinical as used in this activity.
Is that with, I'm assuming that's with regard to the first domain that they're talking about, where we say that that domain has strategic and critical analysis. That was the name that we gave it. What that domain really consists of is a series of items, if you look across the individual items to that domain, that start with the initial ideas about conceptualization of data and the collection of data, all the way through to the analysis and interpretation of that data and the reporting on that data. So, and those reporting ones also go over a bit into communication, but they're there as well. And so that first category, that first domain, if you like, is really a domain that focuses on analysis, what we call critical and strategic analysis. May or may not be the best title for it, but it does indicate, I think, very clearly, because of its importance, that evidence-based work in public health is crucial to virtually everyone across all the categories that, of demographic categories, social categories that we assessed.
Well, this is Jim Yeager, but I think what he's referring to, the question is referring to, is in you know, where we had this is what individuals classified themselves really as: clinical consultant, entry, mid, and upper. And we had decided, you know, time time ranges for entry, mid, and upper, and then classification of, as consultant or clinical. So I assume that people indicated that they were clinical who were working in a clinical setting, hospitals or, in a medical practice type of setting. But
maybe I misunderstood. I thought the word.
Yeah, we didn't define clinical. It was defined by the people who filled out the survey.
The word was clinical and not critical. I thought it was critical that they were asking about. I'm sorry.
No, I think
apologize.
The question was clinical.
Okay, that's a different question.
Yeah. So did we answer the person's question?
I believe so. If not, perhaps they will write another question. Another question, similarly, can you provide clarity on who falls into the academic category of public health professionals?
Those were individuals who, in terms of their classification, fall into jobs that are in academic settings of one form or another. There's a potential for a broad range of academic settings there, but that's what we were calling academic. It may be individuals who have, generally speaking, research roles as opposed to perhaps teaching roles or other kinds of roles. So they might be in a health science center with that, but they were identified as being in an academic setting.
Right. There were assistant and associate professors, but very few. So what Rick is saying, I think, is many of them might have been individuals working, on projects, research projects, or practice type projects that are, but they're based in a university or in a school of public health or a school of medicine.
Great. You said that you might perform another job task analysis in the next 5 years, but you also said that for the next steps, the goal may be to impact the CPH exam. Do you have a timeline associated with those next steps that you detailed on one of the last slides?
Yes, we are working on that, I would say, but we are going to try over the next 6 to 9 months to really go through a process that does refine the core content outline that we use for the exam. We have a very well-established content outline now. It's on the website. You can go look at it. So before we were to change that, we want to be sure that we're moving to something that is better, more appropriate, if you like, and that we give enough time so that we would probably give an entire year before that content outline would be used as the basis for the exam, the new content outline. So even after we finish our work, there would have to be a gap before any exam had that was based on that new outline. And obviously this is a very detailed process because we have large banks of questions for our exam, and we would have to go back through those and see how they related to a new content outline. We might have to create new questions. So it's a very extensive task, and it will take us many months to accomplish that.
Yeah, there are over 2,000 questions in the question bank, and as Rick said, one of the first steps now will be to take these questions, and we're seeking some volunteers for to do this, and begin to map them to these domains and tasks that have been identified as important and very important, etc., from the survey, and then identify gaps, or questions that just don't map that way. So it's given the large number of questions, it is a big task, and it will take quite a bit of time to do that. And then, do we need to have some, where do we need new questions? Where are the gaps? So that the questions, can be obviously questioning whether individuals have, the theoretical knowledge, but at the same time, the questions are related to tasks that ultimately they would be performing as they entered the workforce.
And become established in the workforce.
Right.
Great. All right. I don't see any other questions. Are there any last thoughts you'd like to leave with us, Dr. Kurz or Dr. Yeager?
I would simply say that if individuals have an interest in this for a time period, we are going to continue our analysis of the job task analysis. That will take us a little time, but there will be a time when we will, with some rules probably, we will make this information available to other researchers, individuals who would like to do further analysis, maybe beyond what we had thought about in our own work. And so I would like to make those who are listening to us today aware of that, because they may wish to follow up at some point in time given their own work. And this is a fairly unique data set. We know of no other public health job task analysis. Obviously our field is very diverse. This is not a job task analysis, as we sometimes say, for a dental hygienist, which is a much more constrained role. And so it does lend itself to more analysis, and we hope that others, as well as what we're doing, will jump in and ask good questions and use this data effectively.
This, could be, a master's student project to take this data and do certain types of analysis, and so anybody who might be interested in that in the future would contact Allison or Rick. I think that we also are planning to publish the results. We're now thinking about the organization of a paper and what we would put into an initial paper that would summarize this data.
Great. It sounds like a lot to come. Thank you to, all for joining us today, and thank you to our speakers, Dr. Kurz and Dr. Yeager. As they have stated, please do not hesitate to contact either those Allison or Rick, whose emails are listed on a previous slide, or webinars at ASPPH.org with any follow-up questions. A recording of this webinar will be available along with the slides on the ASPPH website in the next few days. And please be on the lookout for additional webinars in the ASPPH Presents series. The next one, Where Do Public Health Graduates Go? Results from the ASPPH Graduate Employment Pilot Survey and Plans for the Future, will take place at noon Eastern on Thursday, October 22nd. Thank you.